Hello everyone, welcome to Career Brief face-to-face. My name is Oh Joon. I have Dr. John Clemens with me, and we are going to have a little conversation on the ongoing COVID-19 pandemic crisis and also its possible impacts on human society in the future. I'd like to start by asking you kind of a fundamental question because I have heard some say that all of these have been caused by because the human population has grown to an unsustainable level, and a lot of people are getting too close to animals. So we are messing around with the habitat of animals and plants. We hear stories about how getting too close to animals like bats, camels, chimpanzees, these are causing all kinds of various virus diseases. So what is your take on this?
Yeah, so that's definitely true. And of course, over the decades and centuries, the human population of the Earth has grown tremendously and has encroached on environments with animals, putting people into contact on a scale that never had happened before. I might add that what has amplified that that effect has been the progressive aggregation of humans into urban environments and cities and crowded environments, which means that once the virus jumps from animal to man, its transmission in men, in humans, is enhanced. One saw that with the West African Ebola outbreak. It really surged when it got into the cities.
So you mean they mutate?
Well, what happens is the viruses generally that are adapted to humans need to mutate somewhat to get into man, and they often need to mutate or reassort their genetic material even further to become easily transmissible among humans. But I might also add, another factor that has added to this is the food industry, in which huge numbers of animals are congregated in very tight spaces, giving much more opportunity for viruses among the animals to reassort with one another, change their genetic material, and jump to man.
Yeah, I think to put it simple, there are too many humans and too many animals we have domesticated. Well, the coronavirus pandemic that obviously started in China, actually only a few months ago, we feel like it's been ages, but actually we heard about the coronavirus first time at the end of last year, and now it's spreading all over the world, very fast. And it is rampaging in Europe and North America, in addition to China and Korea. And even if Europe, North America, and in some Asian countries like China and Korea, even if we are getting out of the woods, probably the outbreaks will continue or even will rise in the rest of the world, including the developing countries. The country where you're based, like Bangladesh, are not free from this pandemic. And when the pandemic is in full force in developing world, a lot of people are worried because the consequences will be even more serious, because they do not have sufficient healthcare system. So what do you think about this possibility of this pandemic reaching the developing world in full force?
Well, there's clearly a very high risk of that for several reasons. In the developing world, such as Bangladesh, the growth of the population is in urban settings. Let me give you an example. I worked in Bangladesh as a young scientist in the 1980s when Bangladesh was 10% urban. Now it's 25% urban, and in 2050 it will be 50% urban by population. What this means is that people are living very, very close together, and in addition, much of this growth is occurring in these huge urban ghettos. In Bangladesh we call them bastis, in which there's tremendous crowding. Bangladesh is the most densely populated country in the world overall. These ghettos, these urban slums, are 8 times more densely populated than the national average. You often have 8 to 10 people living in a single room. And under those circumstances, the concept of social distancing really has very little meaning, and that's really something that will enhance transmission. As well, many developing countries are affected by a double burden of disease.
What do you mean by that, double burden?
Just about to explain.
Yeah.
And on the one hand, they're affected by traditional problems of developing countries, like malnutrition. Okay, and a certain part of the population is affected, and their immune systems are compromised by that. On the other hand, a portion of the population is affected by the diseases of affluence, diabetes, hypertension, chronic obstructive pulmonary diseases. These are epidemic now in developing countries, and they are well-known risk factors for severe coronavirus disease. So in both respects, the population is a setup. And then finally, as you mentioned, the healthcare systems of developing countries are very weak. Very few hospital beds per capita, very few doctors, nurses per capita. And so if it hits, it may hit very, very hard. But that being said, there's one factor working in favor of developing countries. And developing countries, because of their high birth rates, have a population pyramid that consists of a preponderance of very young people, in contrast to Korea, for example. And it's well established that young people are at much lower risk of getting severe disease. So one could have a scenario in developing countries of very high rates of infection, but not necessarily such high rates of severe infection. But where that balance will pan out between young age and comorbidity, weak healthcare systems, one doesn't know.
But I have read writing by my former colleague, UN Ambassador Samantha Power, last week, and she argued that it's going to be more problematic when the pandemic reaches, for example, Africa, because many African countries don't have enough, medical facilities and equipment. For example, ventilators. She cited that in South Sudan, the total number of ventilators they have is less than 5.
Sure.
So that's going to be a huge problem if you don't have medical preparedness, and then you are hit by this pandemic.
Sure.
But on the other hand, some people think because this is virus, virus doesn't like hot and humid weather. So, if we get closer to summer in the northern hemisphere, and even in some developing countries where the climate is very hot and humid, we might see a decreasing force of infection. So that will help. So these are kind of opposing views about the lack of medical preparedness and the seasonal effect. What do you think?
Well, in the laboratory, the virus seems to grow less well at hotter temperatures. And it's true that the relationship between ambient air temperature and prevalence of disease, favoring disease at colder temperatures, applies to influenza and several other respiratory viruses. Whether and how much of an impact it will have, we don't know. But you can see that there are factors that will be acting to facilitate more infection, crowding and so forth, and more severe infection, comorbidity. But there are also factors that may be mitigating, young age groups, hotter temperatures. We just don't know where that balance will fall.
Well, talking about developing countries, as you know, our divided nation, North Korea, is also one of the least developed countries actually, and it's not too clear whether they have this pandemic yet, but it's reasonable to guess that they should have, and people are suffering from this pandemic as well. And as we all know, they do not have a proper healthcare system when it comes to medical facilities and equipments. They don't have top grade capability. And you've been to North Korea before, I know. And what do you think about the possibility of COVID-19 epidemic in North Korea and their ability to cope with it?
That's a very good question, June. Of course, we don't know very much about what's happening now in North Korea. According to WHO, North Korea has had access to PCR testing for the virus, has conducted something on the order of 1,000 such tests, claims that none have been positive, but at the same time the country has quarantined some 25,000 people. So if without positives, what was the need for quarantining 25,000 people? I'm not quite sure. North Korea is like any country. It is at risk for a severe COVID-19 epidemic. Of course, as an autocratic society, it will be fully able to enforce social distancing quite rigorously. But how that will all pan out, we really don't know. But my fear is that in a population that outside of the cities suffers from malnutrition, tuberculosis, and a variety of other ailments that may impair the immune response, the situation could get pretty nasty there.